We are pushing it really hard. We're also pushing something else, the vaccines. We are very confident that we're going to have a vaccine at the end of the year. By the end of the year, have a vaccine.
By the end of this year?
We think we're going to have a vaccine by the end of this year.
You did talk a lot about hydroxychloroquine.
I do, and
for
I
a
still
while,
do.
And there were some studies that came out that questioned the cardiac tie, but you stopped talking about it.
One study, but there were studies that came out that say it's very good, too. And I'll tell you what, I've had 3 calls in the last 4 days, of people that took it, and they're giving it credit for saving their lives. And other other countries are using it. They're bragging about it. You look at their numbers. Here's what we've been reduced to in this country. The Democrats, the radical left, whatever you want, would rather see people, I'm going to be very nice, I'm not going to say die, I'm going to say would rather see people not get well because they think I'm going to get credit if, hydroxychloroquine works. And I don't care about it. I have nothing to do with it, by the way. Everyone said I own the company. I have nothing to do with hydroxychloroquine, other than if it worked, it would be great. It would be so good for our nation because it would save people. But, we've had some very good, there are certain countries that swear by it. They have a much lower number. You know the countries I'm talking about.
But you're putting your real chips on the vaccine being fast.
Oh, I think we're going to have a vaccine by the end of the year. Now, the doctors would say, well, you shouldn't say that. I'll say what I think. I've met with the heads of the big companies. These are great companies. Yeah, I think we're going to have a vaccine much sooner rather than later. I think it will be. I think that will be done. I would rather have, frankly, therapeutic, meaning something to make people better, if not a cure, at least a therapeutic. And, look, we started the other day with Gilead. I really think so. But we're going to have other things. And it could be that hydroxy is going to be, we don't lose anything with hydroxy. It's been out there, Brett. It's been out there for so many years. Then they start doing the false reports. It's been used for numerous things for many years. People aren't dying from it.